I said, I work it out.
It's just the feel, right?
Yeah. Now Bryce, he just straight through, but we're gonna get it done, and we're gonna, you know. I like we kind of go with it, you know. Like sometimes I can just put them up here and just say, okay, we're gonna hang out a minute.
Yeah, right. Yeah, so we generally like it the other way around.
Yeah.
Get time out.
Yeah.
Yeah, I don't have
Still think when I did Barnum after you got through my fingers when
yeah, I'm not sure so I gotta do
it sounded like I got backwards in his mouth the whole time.
I need to get your number because you know about all the press conferences probably before I do.
I don't know. I
Speaking
get
of
it
which,
last
does
night.
the city plan on having anything today?
Not that I know of. I know the county did something earlier.
Yeah, right. Yeah. Right.
Good afternoon, and thank you for being here today. We sincerely appreciate all that you are doing to keep our citizens informed during this COVID-19 circumstance. We want to work very hard to keep you informed and therefore give you the information that you need to keep the Mississippi public informed. It's a little warmer out here today than we were last time. It's summertime in the South. It feels like to be late March. It's a beautiful day here in downtown Jackson. What we have done over the last 10 days or so is worked to significantly enhance social distancing to ensure that our citizens are operating in such a manner that helps protect themselves and helps protect their neighbors. To a certain extent, the fact that we have not allowed for groups of more than 10 to gather, the fact that we have done social distancing, that we have ensured that the vast majority of Mississippi public employees and private employees, where possible, are working from home. The fact that I have encouraged those who are feeling poorly, that may have the virus, to self-isolate and to get tested. We think long-term will all make a difference. Certainly will make a difference in slowing the spread of the virus. But to a certain extent, each of those measures, while necessary, were certainly partially playing defense. Dr. Dobbs is going to come up today and outline a plan that he and his team have implemented that I believe will allow us to shift from playing defense to playing offense so that we can deal with the challenges that come before us in the days and weeks ahead. And I am extremely pleased that Dr. Dobbs and his team have taken this approach, and it's an approach that I believe is going to help us protect Mississippians and ultimately will help save lives. So Dr. Dobbs, if you would, come outline it.
Yes, sir. Thank you, Governor. Thank you for your leadership on this issue, and thank you for support of the public health effort fighting this really unprecedented pandemic, most amazing sort of circumstance, I think, of our lifetimes. So if we think about all the things that we've done with social distancing, the role of social distancing is to slow it down. And to that end, I think there has been some success. But if we really want to get ahead of it, we need to draw on the lessons from other places in the world, other places where they've tried different things, to see what is going to be the most effective methods. This is something that we've been formulating for quite some time, but to be honest, we haven't really had the resources to be able to be more aggressive. And those resources are going to be primarily lab supplies, lab capacity. Some of it's going to be protective equipment. Some of it's going to be staffing. But now, especially with the great support of MEMA and their team trying to find us these resources that are so valuable in the response, we're going to advance our mission to a more aggressive, a more offensive strategy. And to that end, I'd like to tell you kind of what we're thinking about. If we think about what's happened in other countries, a couple of places really shine as examples of what can be done to make sure that we're implementing every tool in the toolbox to suppress the virus. And the two places I'd like to reference are going to be Singapore and South Korea. There are a lot of elements of their plan that are easily translatable into the work that we can do. They learned a lot from their SARS several years ago and realized the importance of a robust public health response. And I'll talk a little bit about that. But also we know that some of the Asian implemented sort of activities are not really appropriate to Mississippi, but we think there's parallels that will work very well for our population. The first thing that we really want to look at doing more aggressively is basic case finding, isolation, and quarantine. That's a hugely labor-intensive endeavor to make sure that you find every case, that you make sure when you find a case, your eyes on them, making sure that you know who they are, where they are, and they're properly isolated, making sure they have the proper legal order to make sure they understand what their requirements are, and then from that point doing aggressive contact investigation so that we then identify that second tier of individuals who are likely to be the next generation of infection. And then with that same group of people, making sure they understand their obligation, a legal obligation for quarantine, so that we don't have subsequent spread beyond that level. To identify cases, one of the things that we have to do is we really have to ramp up testing. And that's going to be one of the most important things we want to bring to this fight, is increasing testing. And I'll talk about that at the very end. The second thing we want to do is really work for more aggressive outbreak investigations. If you look at what drives a lot of the disease transmission, especially within the populations that are most vulnerable, it's going to be when disease gets into a nursing home. Or maybe you have a disease transmission within a funeral where there's a lot of older folks who are susceptible. Getting those resources to investigate those things thoroughly, similar to what we saw at the church in South Korea, right? The amount of investment in that investigation was so important to keep it from really mushrooming beyond control. So we want to get those forces involved to make sure we identify all cases, all contacts, and make sure those individuals are isolated away from the rest of the public until the disease can pass its course within those smaller populations of people. The third thing that we want to do that also is going to be very, very important, in addition to the initial social distancing strategy, is going to be community outbreak response. And what does that mean? Well, there are different levels of transmission within different communities. Some counties are going to need more aggressive activities than others. Some cities are going to need more aggressive activities than others. And if there is, say for an example, a county that has uncontrolled transmission beyond which the normal sort of routine level of case identification, isolation, and quarantine is not manageable, then we need to go in there with full force, making sure we send in a team that can do aggressive testing for a series of days, maybe a week, identify as many cases as possible, implement more aggressive social distancing and isolation strategies, such as maybe a temporary period of shelter-in-place order, such that individuals within that community have a time-limited period when they know they need to shelter in place, but has an end date. And the end date is not waiting for the outbreak to resolve, but to give us a chance to marshal the resources, identify as many cases as possible, and get our team on site so that we can control that localized outbreak. And I think that's something that we probably will certainly have to exercise in the near future. Now, as an indicator of us launching into this effort, we still have a lot of work to do to make sure we have the full complement of team members to make this successful. We're going to pull from our Department of Health employees. We're going to pull from all other branches within our own groups that are doing other things. A lot of people have not been as active as before because of our social distancing strategies. We're going to repurpose those folks. We're also going to pull in folks from UMC to help us. We're going to pull folks from the Mississippi Responder Management System who have volunteered to help us. We're going to pull resources from MEMA who are helping us. We're going to pull resources from the National Guard who are going to make this happen. So with this collaborative all-government response, we think we can make an absolutely huge difference. As an example of that, tomorrow in DeSoto County and Coahoma County, we, the State Department of Health, in partnership with UMC, MEMA, and the National Guard, are going to have free testing locations for the community. Now, this is going to be for people who do have symptoms, have fever and symptoms of COVID, but it's going to be a drive-through clinic so that anybody who needs to get tested in one of these areas where they don't currently have a drive-through clinic can come through, get tested, and then we'll follow up with them to make sure that if they need to be isolated, they can be, or if they're not, we'll give them reassurance that they don't have COVID-19. And from here, we will take the lessons learned, the success from these operations, to then springboard into more aggressive actions as this epidemic evolves. We are well over 400 cases. We had 108 new cases yesterday. We expect to see more and more cases as the next week or so evolve. We have 6 deaths now. We will see more deaths. This is time to be aggressive. I'm glad that we finally have the resources and sort of the manpower plan to make something happen. It's still going to be a rough road, but now's the time to act. And that's all I have. Thank you very much.
Thank you, Dr. Dobbs. I think the people of Mississippi can see the knowledge that Dr. Dobbs brings to his post, and it is very clear and evident not only to myself but to the people of this great state of why I am listening to the experts when making informed decisions to help protect the people of Mississippi. And so with that, I will also tell you that I have committed to utilize every power that I have to ensure that the resources are available for Dr. Dobbs and his team to implement this strategy. I believe it is one that is well-founded, and it's the right strategy for Mississippi at this time. The point is, as we continue to see more and more cases, the more data we have, the better we will be to be able to respond to this particular situation. And we're going to continue to gather data just like they're continuing to gather data in Washington. So with that, I'm going to open the floor to any questions that you may have of myself or for Dr. Dobbs. We also, of course, have Director Michelle here with the Mississippi Emergency Management Agency that would be happy to answer any questions, as well as General Bowles with the Mississippi National Guard. Ross, you're the first hand I saw go up, but we're going to stay here for a while and answer all your questions. So.
Dr. Dobbs, can you tell us why you selected DeSoto and Multnomah County? Is there something going on in those two counties that you are focusing on?
Yeah, that's a great question. Thank you. There's a couple of reasons why we selected those counties. There's significant case burden in those areas, and we're also trying to target our state efforts such that they complement private clinics and community hospital efforts. And so those are areas that have some significant need, both in case burden and then also to enhance their local testing capabilities. We're not going to stay there a long period of time. It's going to be a one-day mission to get out there and test as many people as we can, not only to diagnose disease, but to get a sense of disease burden within the community. Yeah. No, that do have symptoms. We do want to test people who have symptoms of COVID. Well, up to a capacity for COVID symptoms. We're using the model from UMC and their process, and we think we'll be able to test everybody who has need in those areas. Thank you.
The South Korean model has a couple aspects to it. Some of them, like the private clinics, are something that we're adapting here. Two of them that I'm curious about are the fever testing. Is there any attempt to do something like that that is in the works?
You know, some of the stuff we think makes a lot of sense and some of it doesn't. We're such in a stage of social distancing that may not have as much utility, especially if you consider a lot of people who are contagious actually don't have fevers. And so we really need to assume that everybody issue legal orders for people to stay at home. We do monitor them to make sure they're honoring those, and there are actually legal consequences for people who violate those.
Dr. Dobbs, to follow up to that question about the South Korea, they test a large percentage of their population, and that's been cited as one of the reasons that they will contain it. What limit of tests are you looking to get the state up to?
So I believe they did about 5,200 per million population total when I look back at it, and I would like to conceptually get well over that per million for Mississippi. Yeah. Now, you know, there will be resource constraints, but we have a great team, and we've kind of overcome those serially. So I have every confidence that as we find new bottlenecks, we'll find new solutions.
Dr. Dobbs, you talked about resource constraints
Yeah.
just then, and then I know the other day as well. At any point, will the restrictions on testing be relaxed to some degree so that you are testing more of the population, not just those exhibiting maybe all of those?
Yeah, yes, absolutely. So as we learn more also about because older folks actually don't have as much fever, it may well be that the criteria become a little bit more adaptable to the needs as our resources become more available. So absolutely yes, but still people who do have symptoms of COVID, not people who are worried well. Yes, sir. Yeah, I do not think it's too late at all. I think it's the perfect time. I think we're just starting to ramp up, and I think the social distancing has slowed things down somewhat, but we don't need to kid ourselves that that's going to be enough. We got to do more. And then, Governor?
Well, the term resources needs to be defined in a couple of different ways. So in terms of resources as to general resources as to the dollars that are needed to allow for Dr. Dobbs to staff up, etc. A big portion of those dollars are going to be coming to the state, assuming the House of Representatives in Washington, D.C. votes on the bill that the United States Senate passed 96-0 last night. It appears we were just on a call with President Trump, Vice President Pence. They are very confident that the Speaker is going to bring that bill up for a vote. That bill has about $2 trillion in it, as I appreciate it. I certainly haven't read every word of the bill, but as I appreciate it, it has about $2 trillion in it, of which approximately $150 billion is allocated for state and local governments. Of that $150 billion that is allocated for state and local governments, $11 billion of that is earmarked for Indian tribes and territories. That gets you down to $139 billion for state and local governments. My appreciation at this time is that of that $139 billion, 45% of that is earmarked for cities that have a population of 500,000 or more, and 55% of the $139 billion is designed to be sent to governors in all 50 states for their allocation of those dollars. There, as I appreciate, there is a floor of how much each state gets, and the rest of the money will be distributed based upon population. Now again, this is the way in which the bill was described to me by Secretary Mnuchin on our call shortly ago, as well as members of the Republican Governors team and the National Governors Association team. And so I believe that is the way in which it will be outlined. And so when you talk about resources in terms of how are we going to pay for various things, that's one avenue to do so. The other definition of resource, as Dr. Dobbs uses it, is resources such as test tubes, resources such as the reagents that are used in the testing model. Other definitions of resources as it relates to that is PPEs, etc. Mississippi Emergency Management Agency is leading the charge. Department of Health is working in congruence with them in terms of the allocation of those resources that are needed. And I'm going to call on Director Michelle to give you just a brief update of what we've been able to do over the last 4 or 5 days in pushing out resource allocation to not only our emergency management professionals, but also to our hospitals, and what our plans are going forward. So, Director Michelle.
Thank you, Governor. Back to your point about the resources, there is no doubt that there is a very short supply of these resources at the national level. Again, we've talked about that a number of times about the national stockpile. What we have found is that Mississippians are doing what Mississippians do, and we've had a number of folks come together and offer to retool their operations to provide us some products. We've been able to do that on some of our lower tiered PPE. The testing tubes that you've heard us talk about here a lot, we have found a local or a Mississippi manufacturer for those tubes. They have been going through various testing phases at the University of Mississippi Medical Center in conjunction with the Mississippi Department of Health's lab folks. We're very close to getting a resolution there. And you've heard Dr. Dobbs talk about the willingness to want to increase testing. Those supplies have been a restriction on that. We are very close within days of being able to get the supply chains where we want them to be able to do those things. We have run into a number of challenges over the last couple of days in getting in some PPE, but we're working through that, and we've had phenomenal success with Mississippians and Mississippi manufacturers. The key there is, and just make this note, the key in getting and integrating the Mississippi manufacturers and those that can is allowing that bridge point and giving them time to retool their operations to provide these products. And up until that point, we're trying to search other venues to get those products, but we're well on our way getting there.
Thank you, Director Michelle. Now, Bobby, that may have been a little bit longer-winded answer than you were looking for, but hopefully that'll get you where you need to be. Yes, sir.
Question for Dr. Dobbs about the South Carolina. One of the things that I noticed that they did is they kind of used sort of an Amber Alert system to let people know, not necessarily the monitoring of cell phones, but to let people know if there's a COVID-19 case in your direct area. Is there any sort of information class or alerts that you're planning on sending out to?
Not so much around that, but as far as increased situational awareness, community awareness about the nature of the disease there and how important it is. And part of that is going to be this sort of like more flexible model that if a community is doing well and doing the social distancing and they have few cases, there's little reason for us to either impede their normal lives or to marshal resources to that need. But in areas where that's needed, it's really going to be more of a incorporating that situational awareness along with a more robust response in those local areas. We're very different than South Korea. And if you think about the population of Korea, how much of it's focused around the city of Seoul, they're a very urban sort of population. And so we can also use our geographic advantages of rurality to help us as we fight COVID.
Real quick.
Yeah, you bet.
The other, never mind.
That's okay. Thank you.
Can I ask you about your latest executive order that's proposed to restaurants, whether that's received orders that have been instituted by mayors across the talk about that?
Right. Well, thank you for that question, and I will tell you that we are working on an executive order right now that clarifies the initial executive order that we issued. In my interpretation of the order that we put forth, and you know what they say about lawyers, you put 3 or 4 lawyers in a room reading anything, they're going to come up with 3 or 4 different interpretations of exactly what it says. Let me tell you what the order actually says, and let me tell you that the order says what the intent was, and I'll tell you both of those. The intent of the executive order, because if you'll recall, some of the same folks that are upset today were upset a week ago because we had not issued statewide guidance on some things. And so my view is the executive order with respect to municipalities, and by the way, I spent most of the day or much of the day yesterday meeting and discussing with the executive committee of the Mississippi Municipal League, with primarily Democrat mayors across the state who had already implemented orders in their towns, and outlining this to them. And in essence, what the EO does that we issued, it sets a statewide requirement for a couple of things. Number one, you cannot gather in social gatherings with more than 10 people. You cannot open a dining room of a restaurant or a bar unless you can comply with the social distancing guidelines, as well as the not putting more than 10 people in the same space. And in addition to that, it also ensures that essential business operations are maintained. And so the way in which the order is intended to work is that order is a floor statewide that applies to all businesses. If any municipality wants to utilize their local emergency powers, and a lot of them do, and that's perfectly fine. If they want to utilize their emergency powers to go beyond what that statewide order does, as long as their order is not in direct conflict with allowing for what the state order says, they're perfectly fine to do so. I met and discussed yesterday for a good long while with Mayor Tannehill, for instance, in the city of Oxford. In the city of Oxford, she has more or less shut down the square, both retail shops as well as bars and restaurants, to anything other than takeout. She's perfectly within her authority to do so, and therefore the order that they issued before the state order allows them to do that. What the second part of our order does in defining essential services is it ensures that no order by a municipality or a county, for that matter, but no order can keep those essential services from going on. I'll give you an example. So if a mayor in a particular town wanted to issue a curfew, they certainly have the authority to do so. They can have a curfew. They can do other things, because while that may exceed what the state has done statewide, it gives them the latitude to do that. But what they can't do is they can't have a curfew that impedes someone's ability who works at a grocery store to drive from their home to the grocery store to work, because that grocery store is defined as an essential service and that people need to get. And so we're going to look towards some clarifying language so that our mayors feel more comfortable. Many of them are working very, very hard, and we want to allow them to do what's best for their communities, because much like the federal government is not mandating to all states exactly how we respond to this, and the reason they're not is because in today's environment, where we find ourselves in the cycle, what is necessary perhaps in states like New York or California is not necessary in places like Mississippi. The same can be said in our state. For instance, we're very concerned about what we're seeing in the state of Louisiana and particularly in New Orleans. That is fastly becoming a hot spot, and that concerns us. Because of that, and I'm going to be having calls with other governors later today trying to address this, but because of that, our response at the Mississippi Gulf Coast, perhaps in Pearl River County, what's needed there may be very different than what's needed today in Issaquah County and other more rural parts of Mississippi.
So let me ask, is your clarification to limit or totally restrict dine-in services? But that seems to conflict with what Dr. Dobbs.
So what our clarification is going to do is to clarify simply that the order, as we have done it for all statewide businesses, is at this level. But if an individual city or municipality wants to go beyond that, well, they certainly have the authority to do so.
Again, are you going to restrict dine-in services?
Statewide, what we have done is we have limited dine-in services. Yes, we have limited dine-in services statewide to either those entities that can comply with the no more than 10-person rule. So if you have a small community restaurant in Prentice that has, including employees, 4 or 5 people dining there, then you are in compliance with the state EO. If, however, the city of Prentice decides that they want to limit all restaurants to only dine-out services, they have the authority to do so. But we're not going to change the ability of those small business owners to operate. Well, but the order as it currently exists is very clear that for a restaurant to allow for in-house dining, they have to be able to do so in a way that complies with our social distancing recommendations, as well as that they comply with our requirement that no more than 10 people be socially gathered. Dr. Dobbs, and I'll let him speak to it if he'd like to, has made a recommendation regarding that. The State Department of Health did. And so what we did when issuing the executive order a couple of days ago, at that time there was a recommendation in place by the State Department of Health, but there was no statewide guidance on what to do. And so we actually made more restrictive guidelines statewide than what was in place 2 days ago. Because 2 days ago, if you were in a restaurant in which there was no city ordinance, then you could open up with 500 people in there, and there was no ramifications, no repercussion. So we limited that to those restaurants that could actually function with less than 10 people, that it experienced social distancing, and so we've made it much more restrictive. And we think that's the right thing to do at this time, while giving mayors the ability to recognize that what's going on in Gulfport and what's going on in Myersville are not one and the same. Cordianne? No. The definition of essential services is by and large consistent with essential services as defined by the Department of Homeland Security, their cybersecurity and infrastructure task force. And so if you'll look in the executive order, you can get to down, and it's on page 3 or page 4, there's actually a website link to that. And so that it's basically Office of Homeland Security's in Washington's list of essential services. It's more or less one and the same. Emily?
Governor, people are having a lot of difficulty getting Governmental security supply benefits either by phone or online. Is there going to be an effort to put more staff on that agency to help with that process?
Yes, we are aware that is an issue. It is an issue, and again, I just got off the phone with other governors. It is an issue in the state of Mississippi. It's an even bigger issue in many other states. The unemployment numbers came out today, and the total number of unemployment claims this week, when compared to a week ago, was up 1,200%. And so, yes, there is some challenges with our agency, Mississippi Department of Employment Security, and around the country, and we are working with our director to address that. Yes, ma'am. Sure.
Other states and the hotspots, we've been tracking cases per capita across the nation. I know it fluctuates constantly, but consistently this week, we're oscillating between 11 and 12 nationwide. Can you speak to that from a public health perspective, why you think that might be, and concerns you, or is it has to do with the changing approach?
Well, certainly we have more cases, and we're watching it very closely. If you look at the map, you see we're distributed throughout the state. So we don't really have, except for a couple areas with a little bit of concentration, it's pretty well distributed. The other thing is, if you look at the number of tests we've done, we've actually done a lot of tests. We were actually a little bit ahead of the game. I think part of it is that we have done, we're still trying to get a figure on the private labs, but if we look at the Department of Health, we've done well over 4,000 tests at the Department of Health. And if you double that for, which is probably about right for the private labs, just as a back of the envelope calculation, we're looking at 8,000, which is going to be quite a lot. And so we're really trying to get out there, and I want you to see a lot more cases next week because we're finding them. But again, we are very much watching that number and very concerned. And that's why we think we need to be aggressive now. I would have done it a few days ago if we had the resources, but now we have the resources.
What I wanted to ask earlier is,
Uh-huh.
to my knowledge, any actions taken by the Mississippi State Department of Health are not subject to the restrictions in the executive order. Is that correct? So if you were to issue a stay-at-home order for a region or something like that, you could do that.
Oh, I'm sure we'd be in lockstep. Yeah, I mean, he's fully supportive. The governor's fully supportive. I don't see an issue with that at all.
Can you walk us through what that process would look like? How you would approach doing that for certain regions like DeSoto or like Delaware
Right.
Coast, something like that?
Right. Theoretically, we'd identify a location that meets a certain threshold, and it may well be that when we realize that there's more cases than we can keep up with our normal sort of contact investigation, to say, look, cry uncle, it is physically impossible to track all these people down, then we will need to mobilize a testing unit, mobilize an EPI task force to get down there, augment local capacities, work with local political leaders, make sure they're ready to accept the assistance, work with local physicians and clinics and practitioners, go in, do a massive testing effort, and then augment that case finding, isolation, quarantine response. And then again, just for a limited supply, it's kind of like a pull out all the stops sort of thing. And also looking with law enforcement to making sure that we're actually enforcing these isolation orders and quarantine. And then also looking at technology options, which we do have some limited capacity, but it'd be great to be able to access those as well.
If I just say one thing.
Yes, sir. Yes, sir. Thank you.
I just want to reiterate something Dr. Dobbs said and be clear. I said it the other day, and I'll say it again. Should the public health experts make a determination that there is a region or a county or a city that needs a shelter-in-place order, I am prepared to enter it. When it is in the best interest of the citizens of Mississippi, I will be willing and able to implement it. And I want to be perfectly clear about that. At this time, none of the experts in President Trump's cabinet, nor any of the experts in Mississippi have advised me that it is necessary that we do that, statewide or otherwise. But we are looking very closely. The other thing I want to say, because I think this is important, earlier today on the call with President Trump, our neighbor to the west, Governor Edwards, was asking for some specific things as it relates to the outbreak in the city of New Orleans. I had the opportunity to speak immediately following Governor Edwards, and just wanted to reiterate to the President and Vice President that I am in full support of what Governor Edwards is asking for the city of New Orleans, because what happens in New Orleans is going to have an effect and an impact on the Mississippi Gulf Coast. By the way, it's probably going to have an effect and an impact on the Alabama coast as well as on the Florida Panhandle. And that's the reason you're going to see other governors and I sit down and talk about that. But I tell you that to say this is not a situation for politics. This is a time for us to come together, recognizing that we all have challenges, but I am very supportive. I spoke with Governor Edwards personally earlier in the week, or maybe over the weekend, and told him that. The fact of the matter is we are all in this together, and we're going to win, but we're going to win by working together. That's true of state leaders, it's true of national leaders, and ultimately it's true of our local leaders as well. So, Courtney, do you have a question?
We're talking about the orders and the like legal ramifications with this new kind of offensive plan that we're going on. Can you talk to me about what's been done for this 400 plus thus far? Has there been any kind of legal ramification if they violate quarantine? Or how is this different?
Well, normally, say like in a contagious disease, say like tuberculosis or something like that, we will do a one-on-one visit, issue in a nice way, an isolation order, so people understand, and people are usually very receptive to it. And there are clear legal implications, that fines and even imprisonment if there's lack of compliance, and that does happen unfortunately from time to time. Up to date, because we haven't had the staffing to do this face-to-face sort of interface, we have basically through less official means issued sort of instructions for isolation and quarantine. But just the robustness required for this is just going to take the full measure of the action, and so we want to staff up to do that full action. Oh yeah, absolutely. As soon as we get to them, absolutely. Yeah, absolutely. Thank you. Early on, we did when we had the capacity, but now that we're getting like 108 cases, we just have a handful of people who are really on top of this right now. We've had to be a little bit less formal in that regard, but the formality needs to return. Yes, sir.
Hold on one second. Did you have a question? A follow-up, Dr. Dobbs? Okay.
Yes, sir. Not too surprising, especially since we're prioritizing hospital testing. So we really want to get those folks identified primarily. We've seen an older population be affected. The older folks who have more manifestations and symptoms are going to be identified more often. One of the things, though, that we're seeing as we expand testing, we're seeing more and more 30, 40-year-olds with lesser symptoms. So that's not surprising at all. If you look at the mortality rate compared to our case detection rate, it's right in line between like 1 and 1.5%. Now, I personally strongly feel that that's not the real mortality rate, right? That's the identified mortality rate based on the number of cases you find. If you look at estimates by Dr. Fauci and looking at the mortality rate, say, from the cruise ship, it's going to be on the range of, say, maybe 2 per thousand for the general population. But if you get it in these older folks, more vulnerable populations, it's going to be much higher, and that's why it's so very important we protect those folks.
Ross. Yeah, and I can let Director Michelle speak to this. Here's what I can tell you for sure. I know on Saturday, over the weekend, we received 2 different shipments, maybe 3 different shipments from the national stockpile. None of them were as large as what we had asked for. And I will also tell you that, but we did receive them. We utilized the resources of the National Guard as well as our team at MEMA to distribute those, sending both to the local EMAs as well as to local hospitals. We have been, at the request of the President and the team in Washington, encouraging all hospitals to utilize their traditional supply chain sources to attempt to acquire more PPEs. We are aware that we don't have as much as we need. We are continuing to attempt to acquire more and more protective gear for our hospitals as well as our emergency first responders. We also want to ask our hospitals and others to ensure that that we are utilizing N95 masks, for instance, in the manner in which they were intended to be used, and that those on the front lines are the ones who need that and should utilize it. And so, yes, we are aware that there are shortages, and we are continuing to attempt to receive more. By the way, I've said this several times in the effort to be transparent. I was just on a call with other governors. Every other governor in the nation is having the same challenges, and we're hopeful that as these social distancing applications that we have put in place slow the spread, is going to give us some time to get more and more Mississippi companies, more and more companies nationally up and operating and producing many of these supplies that we need. But Director Michelle, you want to address that just briefly?
Just quickly, I am aware, I had, matter of fact, I responded to 2 administrators before I got here about PPE. None of those facilities that were concerned about it were out, but they were getting very low. And keep in mind that the PPE that we do have is being prioritized to those Tier 1 facilities that actually have COVID patients. But we're getting more, and we'll be able to address that as we move along.
General Boyles, are any of the National Guard camps set up to receive patients? Should that be the call?
We're always doing planning with the state of Mississippi and with MEMA and with the Department of Health. We're going to be looking, Governor, at our facility on the coast, CRTC, at Camp Shelby and Camp McCain, all in 3 parts of the state, to see if those facilities meet the health department's standard for care. And they have a plan. We're in that plan. Whether they use it or not is really, Dr. Dobbs, up to your judgment, and Governor, to your judgment. Thank you.
Have you done anything yet as far as going there, making preparation, making sure you have enough beds?
So we've identified and we're limiting it to, if I may, Governor,
Sure.
We're limiting it to rooms that have a bed and a dedicated bathroom. I can house 9,000 people at Camp Shelby, Mississippi, but I can only house about 450 in those circumstances, and we're limiting to that for right now. We are available for a surge if Dr. Dobbs requires it.
I would just say we have not visited. By we, I mean I have not visited those facilities, but stay tuned.
Dr. Dobbs, you mentioned earlier that you're going to have 2 one-day testing centers up in Delta and up in North Mississippi. Are you following the same criteria where they have to call in, get a doctor's permission, get a statement saying that you're that sick or that you are potentially that sick, or can just anyone,
We're-
walk right in?
We're using the same model that UMC is using. They're close partners in this, and we're actually going to utilize their platform for telehealth. They can do a telehealth screening before they get there to make sure that there's someone who qualifies for testing. And we're also going to take phone calls for people who don't have access to that service. And that's actually been extremely successful, such that the people who come through are the people who do need to get tested. In this time of fear, it's a lot of folks are coming without proper indications for testing. This has been a fantastic way not only to identify who really needs to be tested and to use our resources wisely, but also as a communication mechanism, such that we can then, when people call, we can give them the messages that they need to identify what really a risk is and how they can protect themselves.
Dr. Dobbs?
Yeah. Yes, sir.
Well, the governor said he was receptive to put into place a stay-at-home order.
Mhm.
If you had recommended it, what exactly would that look like?
You mean like a stay-at-home order?
Say, for
Would,
instance, like Hines County.
Yeah.
When would you consider suggesting that?
yeah. When it got beyond the capacity of our normal response effort, right? So if, so long as we can keep up with cases, but if we're seeing that it's a lot more expansive and we're not able to track down and keep up with that, we would need to do a reset, basically come in, do a massive slowdown, right, with the shelter in place, such that so that's a tactic to slow, right? And that gives us time to organize. And so we implement that to slow things down so that we can get our teams in place, do some robust testing, and then sort of basically do like a hard reset so that we can
Do
go
you
in.
have any particular numbers of cases, say for instance Hines County,
Mhm.
particular number of deaths?
It's going to be a fluid thing, because if our systems are robust enough to take care of it, but if we think it's going out of control, we need that as a tool also. It's going to be a fluid thing, and it may well be that we activate part of the plan if we think that we need to do the testing and epi capacity plan more than the more than the shelter in place, we can select those different elements out and don't have to be committed to the whole package.
University of Michigan Medical Center is supposed to be putting together their own version of the testing.
Yes, sir.
Where are they along the line?
I think they're close. I wouldn't want to commit for them, but we're excited to have them on the testing team.
Will it have to be certified first and then
Uh,
put into play? Or?
Oh yeah, no, I think they're a certified lab, right? So I think once they get it up and running, and I think it's going to be fast, they'll be ready to go immediately.
Which, by the way, is one of the reasons that we are confident that as we move over the coming days and weeks, that we are going to have the resources that Bobby talked about to do more and more testing so that we can implement the model that Dr. Dobbs has outlined here today. The other thing I want to just mention, I was talking to one of our mayors here in central Mississippi late last evening, and one of the things that he pointed out, correctly so, is that many of the most vulnerable population are not individuals that are typical going and downloading apps, et cetera. And so when Dr. Dobbs talks about the willingness to take phone calls from a telemedicine standpoint, I think that's an important step as well. I love the fact that UMC is partnering with a Mississippi company, C-Spire, because they have a great telemedicine app. But we also have to realize we're dealing with 75 and 80-year-olds in some instances that, I'm a little younger than that, but I don't have a bunch of apps on my telephone either. So we're gonna continue to work that. The best way is to utilize the telemed resources on that application, but we've got to have other means for those in our older population to ensure that if they need testing, that they get it. Yes, sir.
We've received some reports from some businesses around the state, some essential, some arguably not so, that are towards the end of this week beginning to roll back a lot of the protections, work from home, some of the social distancing, calling people back to work. Do you have a message for whether they are covered under this executive order or not, what they should be doing in terms of work from home, social distancing, and all of those questions?
We are not at, nor are we likely to be near the end of this crisis. In fact, we're more likely to be towards the beginning than we are towards the end. And so my advice to all Mississippians has not changed. Stay at home if you can. Be smart. Exercise routine, regular, and strong hygiene efforts. Be sure and protect yourself and protect your neighbors. It is not the time, particularly if you have sent people home and allowed them to work from home, then you have shown not only an ability to do so, a willingness to do so, but also the capability of doing so. Those individuals need to continue to work from home. We are in, I think, close to day 14 since I returned, and we are not going to be calling back state employees, et cetera, anytime soon. You notice that my executive orders, first with respect to public schools, and then most recently the executive order 2 days ago, go until April the 17th of 2020. From a public school standpoint, that gets us out to that's a Friday evening, obviously gets us out to April the 20th. And so when we're talking about length of time with respect to this, there is a method to April the 20th. We may have to extend it further, but if we had thought that we would be out of the woods and in a way where we could go back to normal before then, we probably wouldn't have had the order go to that period of time. Again, please, I am urging Mississippians to stay home if you can. Only go out for the most necessary and urgent things. The vast majority of Mississippians are complying. The vast majority of Mississippians are doing the right thing. I would submit to you that because of that, as the data continues to come in, what we're going to find is that some of the measures that we have put in place are working in slowing the spread. But we can't let our guard down now. In fact, as we move throughout the process, and you look at the executive orders that I have entered, each one that I have entered has actually taken additional steps to be more likely to constrict the free movement of individuals while also protecting individual liberty and freedom. Bobby? Well, I think that we are working with legislative leadership. I've spoken with each of the leaders very regularly this entire week, and will continue to do so. We do not see a need at this point for there to be deficit appropriations, although there will be an opportunity for that in the future. The federal money, again, if it passes, if the president signs it as he plans to tomorrow, and as we understand exactly how that is going to be done, we will deal with that. We had a financial meeting with our finance leads in the last couple of days of each of these agencies, and we are fine for now, but we will not likely be fine forever. The question is, will we have to utilize state resources that are precious to respond to this? We don't yet know, but we do know that there is a significant amount of federal monies that will be coming in that typically these agencies particularly have the ability to escalate federal funds to allow us to get through the short run. But we're not going to do anything without communicating with our legislative leadership. They are a partner in this. They have been working diligently to convince their friends and their neighbors to stay home, which is the most important thing that they can do at this time. Emma? Well, that's not a decision for me to make. That's obviously the legislature gave the authority to Speaker Gunn and Lieutenant Governor Hoseman to make that decision. I will simply say that in my order that I issued, I did say that we should not gather groups of 10 or more for until at least April the 17th. But again, having come from the legislative side prior to running for and getting elected governor, I know better than most that the rules that govern the legislature is determined by the legislature and only the legislature, and so I'm going to defer to their good judgment. They're both good people, but yes, there is as I mentioned earlier, there is a bit of a method as to why we pushed the school opening, pushed the executive order that was issued with respect to restaurants, etc., back to April the 17th. We think, again, that we are not at the end of this challenge. We are closer to the beginning. Again, this is an ever-evolving situation. As I stand before you today, I do not see a need for legislation that is time-sensitive. There is going to be a need for legislation, but I mentioned this the other day. In the immediate aftermath of Hurricane Katrina, when power was down in downtown Jackson for 7 or 8 days, I spent a good bit of that time in the very same conference room in this building that I'm in now, working with Governor Barber and his team responding to Hurricane Katrina. The reality is, Governor Barber that occurred on August the 29th. Governor Barber called the legislature back into special session, which of course they weren't in at that time, but he called them in the very last or the second to last day of September. It was almost 4 weeks after the actual one-time event occurred. And the reason for that is it was, I think, 30 or 40 bills were actually proposed and implemented, working with, at that time, Lieutenant Governor Amy Tuck and Speaker Billy McCoy. And so if we had to have a session tomorrow, I couldn't tell them 5 to 10% of the things that really needed to be done from my perspective at this time. Give me 30 days from now, 45 days from now, maybe 60 days from now, once we have a fuller appreciation and understanding of what the Congress has passed, and I'll be able to do that. Thank you all. Appreciate it.